The case that I was involved in was a gentleman in his mid-30s who worked as a cable splicer. He fell over 20 feet off of a utility pole and sustained multiple injuries, including pelvic injuries, femur injuries, and some upper extremity trauma. Two of my partners were actually the treating physicians for the majority of his care. I was called in due to some problems they were having obtaining union with a distal humerus fracture. The proximal pin, obviously, the radial nerve is the structure you're most concerned about, and we dissected down, thought we had a clear spot, placed the drill guide, but as soon as the drill engaged, I felt something abnormal. We stopped right away, dissected a bit further, and discovered there had been a partial injury to the radial nerve. When I first learned of the lawsuit, I think the first thing was surprise, since it had been quite some time. In fact, I was served papers, I think, just a few days prior to the expiration of the statute of limitations, that being 2 years from the case. The impact that the lawsuit had on my personal and professional life was profound. It really made you feel alone. You can't really discuss a complication with your peers once you've been served papers because that becomes discoverable. You can't really discuss in depth any of the medical aspects with your family or friends. And so really you feel alone. You feel a little bit of desperation and a little bit of anger that, hey, I was this guy's last hope. Yeah, a complication occurred, but we were trying really hard to help him. And then 2 years later, he gets slapped with a lawsuit.
I think it's really important in the case of a physician who's been through this for the very first time is to understand that this is a team approach. It is an approach that both the physician, the carrier, and the experts work together to make a presentation to a jury that they will understand, that they will want to side with the physician, and that they will take with them after the trial. The most valuable aspect of the defense of this case was the presentation of Dr. Wuest himself during the trial. He was able to connect with the jury in a way that they believed that he was a conscientious and competent surgeon who cared about this patient.
Fortunately, the outcome of my trial was a defense verdict in my favor. Obviously, I felt great relief at that news, but I probably felt more relief just the fact that this episode was over. I think there's probably 3 salient points to pass on to other physicians about this experience. The first is it's an incredibly lonely feeling, and you need to have the support of your family and friends throughout. The second thing is the plaintiff's attorney will be merciless. They will say things about you that are disparaging about your skills, your career, your morals. And the third thing is don't expect to go back to work the next day and have everything be normal. It's a lot different, and it takes a long time to get back into the routine, back to not thinking about a patient as a litigant, and going back to your regular job like you did before.